Dyslipidemia recap. Basically, raised cholesterol, raised LDL, and raised triglycerides. These three, and low HDL, because HDL is good cholesterol, it is protective. Other three are harmful. So this is called the dyslipidemia or hyperlipidemia. It's an important cause of human long-term mortality and morbidity. Though it doesn't kill a person immediately, instantaneously, but it has long-term outcome, bad outcome like stroke, the coronary artery disease, peripheral vascular disease, and many other cardiovascular illnesses. Even renal failure is with the long-term cholesterol, because the cholesterol deposits in the blood vessel, impairs the circulation, causes the organ damage, and finally the death. So it is in that way, it is a slow killer. The commonest type of the autosomal, the hyperlipidemia or dyslipidemia, is the autosomal dominant monogenic type. Incidence is quite high, 1 in 500. So that's because autosomal dominant. So someone has it 50% chance of inheritance to his son and daughter, and then your receptor disease. Basically, receptor disease means the LDL receptor activation is defective. So endocytosis, that is internalization of the cholesterol, bad cholesterol, doesn't take place, and thereby their level go up. So you have deposition in the organs like heart and the brain, the kidney, eye, and many others. Even in the skin, xanthomas is common clinically in the Achilles tendon, in the face, in the skin, and in the cornea. So very frequently you will see the people has this sort of xanthoma, deposition of the cholesterol, quite a large obvious visible mass in the skin. So rarer other types are the autosomal recessive hypercholesterolemia. This polygenic variety has frequently coronary artery disease, very high, 1 in 30,000, 1 in 30. Familial combined hyperlipidemia, familial hypertriglyceridemia, and dyslipidemia. So it is autosomal dominant inheritance, familial lipase deficiency, and defective ApoB100 deficiency. They have cardiovascular illness, the brain, heart, and other organs. So treatment of those cases are the lifestyle motivations. Diet 1, child diet 1, the less sugar, less fat, less salt, and more fiber, and then your less processed food, and total calorie restriction, not above recommended level. So and the healthy lifestyles, the body weight, high, your exercise, etc., and statins and other cholesterol lowering agents. Long-term outcome is good, but we should have someone should have almost good amount of time, maybe lifelong, because this is a genetic disease. You cannot stop is going doing bad. So go on giving it until it is needed.